Now, my understanding is Stefano Paleari, rector of the University of Bergamo, could not be present, and it would be very well substituted by another rector, and also my president, Sergio Pecorelli, of the University of Brescia, who will speak on the educational challenge, the role of the university in promoting public health, following on the presentation we just heard. Sergio, you have the floor.
Well, thank you. I'm not really substituting in the sense that that Stefano Paleari, who, by the way, is also the chairman of our conference of directors in Italy, had a very important meeting while we are speaking today at government level. So he asked me to substitute him and say just a few words trying to summarize what he had prepared. First of all, the European University Association is the voice of the European university in order to influence the outcomes of the European level policy debate on issues that will impact both at national level on the work of national university and at also international level. This association looks to support its members in understanding and responding to those developments in an even more complex and competitive global environment. Often the EAUA meets also with the partners in America, South America, West Indies, and Asia. The key priorities are outlined in the organization's work program, and mainly it's building the European higher education area through the so-called Bologna process, the research and innovation, and internalization, and enhancing the quality of the European university, the governance, autonomy, and funding. Why did I say this? Well, because it's extremely important to know that this association is an association of 820 universities in Europe. And I also like to remind all of us the fact that universities started in Europe, as a matter of fact. And they started as a collegium of students. And so that was how it started in Bologna. When we did this experiment, this prototype in Italy, going to the schools, as you just heard from Healthy Foundation, we thought that the idea of asking medical doctors still in the specialization schools to go and preach, in a few words, at an age which is young age, with passion, of course, but also mainly with scientific knowledge. And the field of vaccination is the typical field in which scientific soundness is important. Because of all we have been saying today, we have been hearing today, and I think that so this idea, probably we said, could be used not only in this country, but also in the other countries of Europe, and why not of the world. So the idea of going to Europe was born. The board of EUA met just a few days ago and decided to go along with this idea and ask medical schools in Europe to support this program. Obviously, this is not something that you can do all at once. It's obvious. I think that each country will try to do it, in one regional area, and then, of course, expand it. But this could be one of the many ideas that we can have in order to support not only the vaccination process, but as you heard, also, for instance, all the prevention ideas. We know that prevention is one of the few tools that we do have in order to make systems sustainable. There is no doubt about that. The unfortunate thing about it has always been the fact that usually prevention takes a long time in order to see the results of prevention. Not always, of course, measles, I mean, it doesn't take a long time, but for many, many other instances, it does. And especially when you go to lifestyles. It's obvious. Healthy food or physical exercise are two typical examples. But we know that about 87% of the population dies of chronic disease. And we know extremely well how things are in Europe. In Europe, and I say this for our American colleagues, we are going toward an aging of the population, such as in a few decades we are going to have 1/3 of the population which is age 65 or over. Moreover, we have another problem, and that is the natality problem or fertility problem. This is a typical country where is 1.44 the fertility rate. And we know that each time it's below 2, things are no good in sense of percentage-wise. So I think that all of this has to be taken into very strict consideration, but we thought that trying to have the universities ready for this is very important. Another message from the university is the message about research. We know very well that research, public research, is extremely important for basic research, but also for translational research, as you very well know. And universities are extremely eager to contribute to this. I think that the programs that were said today about research, like Horizon 2020, are important, but I immediately catch the invitation by our friend from the United States, from the CDC, saying that probably what we really need, especially in the field like vaccination, is global research in a way that we should get together and try, in fact, to expand and make a strategy for research in this field. This is badly needed, as it is any program about vaccinations. In essence, this is what we wanted to tell you. There were fantastic slides which I never received, but anyhow, I can tell you that they were very nice. And the problem was that where he was, I mean, there was no internet, so that's it. But anyhow, I think that the real message, the true message, is that finally we should understand that university is an opportunity, and it's not a problem. Sometimes it's seen as a problem as far as money is concerned or expenses. No, this is not. It's an incredible opportunity, and I think that we should take advantage of it. Thank you.